Welcome to Arthritis Now. I'm your host, Kyle Langen, and today we're going to be talking to Dr. Shiva Shahrara from the University of Illinois at Chicago and all of her exciting work in rheumatoid arthritis research. Hi, Dr. Shahrara. Thank you so much for being with us today on Arthritis Now. We really appreciate it.
It's a pleasure. Thank you for having me.
Yeah, of course. And so you are studying rheumatoid arthritis. Can you tell us how you got involved or how you became interested in that area of disease?
Well, early in my career, I did a fellowship in Dr. Koch's laboratory and became fascinated with RA research. And there's tremendous resources in RA. We have access to RA blood and RA specimen tissues, fluid, and we have fantastic animal models of rheumatoid arthritis, which you could study both acute and chronic arthritis. And my lab and very few other labs like to translate findings in rheumatoid arthritis patients. And so the studies that can't be done on the patients, we then ask those questions in animal model and go back and forth. And that's a very useful tool because not many diseases you could do that.
You were funded by the Arthritis National Research Foundation back in 2008. How did kind of receiving that grant change the trajectory of your career?
Well, back then, I remember my lab was one of the first labs that identified IL-17 in rheumatoid arthritis, and we had a very hard time publishing that paper. And so the funding from ANRF was instrumental in making progress in that project. And so we're still evolving in that theme that we are still very much interested in IL-17. And since then, now other labs have understood that IL-17 is very important in the pathogenesis of RA.
And now, so in your lab now, I know you're performing microarray studies to compare the synovial fluid between those who have RA and those who don't. Is that correct?
Correct. That was something that we initially performed, and we have a lot of information. We got a lot of information from the microarray studies, and so those are the base of what we're doing right now. We found genes that were significantly elevated in patients compared to normal donors, and so we continued our study looking at those specific genes. And so one of the genes that, so as I mentioned, TNF and IL-17 are very important in the disease, and for the longest time we thought that the subtype of rheumatoid arthritis is one or the other. Perhaps that rheumatoid arthritis patients are mediated either by myeloid cells or T cells, but now we know that there's a crosstalk between these two cells. So what my lab is interested in doing is finding perhaps pathways that are upstream of IL-17 and TNF, and blocking that pathway would block the TNF and IL-17 crosstalk and interaction. So that's one of the interests in our lab, and one of the pathways that we're studying is TLR5, and we're very much interested in this pathway because we found that TLR5 promotes bone erosion through activating TNF, and it promotes angiogenesis by activating IL-17. So we think that TLR5 is the connection between myeloid cells and T cells. That's why we're very interested in that cascade of events.
And the angiogenesis, that is for those who might not know, it's forming new blood vessels. Is that what it?
Correct. So in order for disease to progress, when you have excessive amount of leukocyte or blood cells coming into the joint due to inflammation, to basically drive this or to perpetuate disease, and to provide oxygen and nutrients to the joint, you need the formation of new blood vessels. So that's what exacerbates disease and enables the disease to progress.
Thanks for watching part 1 of our interview with Dr. Shiva Shahrara. Make sure to subscribe to our YouTube channel and check out all the latest arthritis research on curearthritis.org. We'll see you next time.